Hi, my name is Sanchita Sharma. I'm the Health and Science Editor with the Hindustan Times. Today is World No Tobacco Day, so this is the perfect day when you should think about quitting smoking and tobacco use. And when I say tobacco use, I also mean hookahs and chewing tobacco and other forms of tobacco. So with me is Dr. Sajeela Maini. She heads the Tobacco Cessation Clinic at the Gangaram Hospital. And she's also done a book, which I have with me here, on the last puff, which is going to help you quit tobacco use. So if you have any questions, if you want to stop your addiction, this is the time to ask her. So I wanted to ask you the first question. You've been running this clinic for a decade now. So do you have men, women? What is the profile of people who come to you?
I have patients as young as 14 years, 15 years and as old as 80 years.
Wow, so you're saying 14-year-olds are addicted.
Yeah,
they can't give it up.
14 years, they can't give it up. They're smoking. They're even smoking up. So
wow.
Smoking.
And do they come themselves, or are they dragged by their parents?
Sometimes they're dragged by their parents and sometimes they come by themselves. Okay. Because of the youngsters, it's normally they are dragged by the parents actually pressurize them because they've just started the addiction and they're in no mood to quit the addiction.
Yeah,
because they haven't seen the health hazards as such.
So is that a problem? Because now you have smoking packs with those pictures which tell you that it's going to kill you, it's going to cause cancer, but people still start and they still get addicted and they spend a lot of money. Why? I mean, what's the first step you
see? With the pictorial warnings, I don't think it will have an impact because a person is addicted, he's addicted. He only wants to quit smoking. What happens? Nobody starts smoking to become an established smoker. A person starts just for the heck of it, just out of peer pressure, out of parental smoking, out of whatever, it's my life, don't care attitude. Just because of that, he picks up the cigarette and then he becomes addicted. And unless and until addiction haunts in his head, he's in a denial mode. Yes, I can give it up when I want. So I'm not addicted. So when the addiction actually haunts him in his head and he says, yes, I can't give it up, then it's too late, and definitely then he requires some medical support and things to give it up, because nicotine is very addictive. That's as addictive as cocaine and heroin.
So we have a question from Abhijit Joshi, who wants to know what are the withdrawal symptoms and how can you counter them. So clearly he's somebody who's tried to quit and had a problem.
You know the name of the person?
Abhishek.
Abhishek, don't fear about the withdrawal symptom, because it's about the proper method and the proper system that is required to make a person quit smoking. The first thing is, don't try to reduce cigarettes, because if you try to reduce cigarettes, you'll have more withdrawal symptoms. And if you make it zero, like the target should be zero cigarettes.
You should go cold turkey and just stop.
It has to be cold turkey, and in case you want to have supports are available in the market, but please go cold turkey. It's either a white or black. There are no grays in between. Yeah, so go in that model. Just quit it, give it a shot. The moment you make it zero, the withdrawal symptoms actually do not occur. Yeah, there are very minute withdrawal symptoms which can be countered within 3 days. See, the cravings and the urges are only for 3 days.
Okay, so what are the three major ones that?
Yeah, the withdrawal symptoms. There are no withdrawal symptoms per se. If you make up your mind, you make it. You say it's. I have to make it zero. It's only a 3 days. People actually confuse the withdrawal symptoms with the cravings.
Yeah. So when he
means the withdrawal symptoms, he's actually meaning the craving thing.
So how do you
handle the craving? It's only a 3-day job. People think it's a very long term this thing. It's only 72 hours of the physical cravings. Rest all is mind. Yes, you might have a little bit irritability. You might have a little bit of anxiety, and you might feel that yes, I need to smoke. That is what. Can I have just 2 drags? That is what.
In fact, that's the next question. Also, Mukta wants to know that why do you have a craving? Why is there an addiction?
Why is there a craving for smoke once in a while when you have started smoking? Why is there?
No, because I think tobacco is also designed to get you addicted, right? Smoking is a highly addictive substance.
Because I told you, the moment the person comes out of that denial mode, he sees that yes, he is finding it very difficult to quit. It's in fact more addictive than cocaine and heroin. That even research has WHO also documents that.
Yeah, they say in fact that it's the only legally sold product which kills if you use it the way it's designed to be used.
50% of the users. That is also
50% of the. In fact, that's a good statistics. If you want to quit, this is what you should keep in mind. Tobacco.
Just make it
50%.
Zero. Yeah. Just if the people want to quit, just make it zero. the withdrawal symptoms will be nullified. It's how you take it actually. People try and make it take the reduction model. That I smoke 10 sticks a day. From tomorrow I'll do 8, then 6. These methods don't work. Make it 0 and withdrawal symptom, whatever are there. It's actually confusion between the withdrawal and the cravings. They'll be handled within 72 hours. It's only 72 hours.
And if needed, you can prescribe.
We can give them supports and we have now very effective medications, Sajeela, for making a person quit smoking. They don't actually feel like the people who are coming to my center. I handle the withdrawal symptoms so nicely. They don't actually have any withdrawals, physical withdrawals.
We have a question from Lokesh. He says his father has stopped smoking for the past has been smoking for the past 25 to 30 years, a very long time smoker, and he stopped smoking for the past 2 months. So he wants to know what precautions, or as a family, what kind of support they can give the father to help him stay off smoking.
I think that's a
father
needs to take the